a big focus of this session will be for folks who are already planning to go to COP29, kind of giving a history of the UNFCCC process and COP overall. We'll share a little bit about the logistics of how things work at a COP. I did see a question about how to attend, and we do cover that a little bit. Generally, in order to attend any meeting with the UNFCCC, you need to have an organization that receives accreditation. And then after that, you have an accredited organization. Those organizations are given a certain number of badges, and then people can attend on the badges. We generally don't recommend people travel to a city where COP is happening if they don't have a badge, partially because there's much less to do and it can be expensive to travel to a city where COP is taking place. If your organization would like to sign up for accreditation, we ran a session earlier in the year in April about applying for UNFCCC accreditation status. We can try to send, if it's, Milena may be able to find a link for that and drop that accreditation information in the chat. Yeah, if you don't have accreditation organizationally at this point, you wouldn't be able to get it in time for COP29. However, it's on a rolling basis, so you might be able to apply to attend for COP30, and some of the information shared during this call will also be relevant for that COP. Okay, with that, I'm going to get started. Great. So we're going to, as I said, give an overview of COP and the UN process that it fits within. We'll also talk a little bit about climate and health more generally, and then we'll go into ways that the COP and what happens in an international context gets integrated into the national context. So brief agenda, as I just said, context and history. We'll go through what happens at a COP. We'll talk through some logistics, and then we'll talk about national plans. And there is time to ask questions all the way along. I will do my best to pause to make space for questions, and you're also welcome to ask questions in the chat. So overall, COP is one way to make change, and as we are working at the intersection of climate and health, we've kind of got 8 key priority actions that we as GCHA are thinking about. Last year, we worked with a broad group of community members to come up with a climate and health narrative for COP28, and that sort of outlines some of these actions as well. And the one other thing I'll say is we will send around this slide deck to anybody who registered for the webinar, and any links that are mentioned during the webinar will be in the slide deck. Milena is going to also post some of them in the chat as we go, but don't worry about catching the links. They will be there. So the first priority is that health actors should be active collaborators in planning for a climate safe future. So there's lots of people doing work to build a safer future in the face of climate change, and health actors in the health community have a really important role to play in that journey, and we need to do that in collaboration with people who are already doing that work. Good public health policy is working on prevention occasionally as well as the cure, but we know that working on prevention of an illness is often less expensive and more effective than having to cure that illness farther down the road. And one could say that climate change is like an illness in that way. So fossil fuel phase out is that preventative action that we need to take, that we need to be taking as we're already responding to the impacts of climate change. But both because the burning of fossil fuels is contributing so greatly to the climate crisis, and because fossil fuels themselves have many health impacts, we really need to be talking about fossil fuel phase out and a just transition to deliver clean energy to everybody in the world as a public health imperative. We need to be, whether we're talking about it in a COP space or at home, need to be transforming our health systems so that they're low emission and also climate resilient, so that they are working on clean energy and they're not contributing to the climate crisis, but also that they're they're braced and ready and properly staffed and properly constructed to be ready for major climate impacts. We need to be thinking about how we build our cities, communities, urban spaces, and transport systems to promote health. So you thinking about not just how can health be protected by the health system, but thinking what are the ways that transportation systems in your city could be lower emission, which would lead to less air pollution, and might even mean that people can get around more easily, could get to medical appointments more easily with a clean, low emission public transportation system. We can't just be thinking about, in the context of climate change, we can't just think about health in our clinics and our hospitals. We need to be thinking about all the ways that health can be protected and improved through climate solutions. Of course, we need to be thinking about expanding and securing access to healthy food and clean drinking water, which will be threatened by climate change. And to be noting that, oh, I've miscounted. I think there's only 6. At one point there were 8, but you're lucky, just 6. Climate change will threaten the gains that we've made in health. So we have been expanding UHC, and that will be threatened in a climate change future where it's harder to get to places. Clinics that have been built may be destroyed by extreme climate events and extreme weather. We also are seeing that progress that has been made in malaria is being counteracted by the fact that with warming temperatures, malarial mosquitoes are able to expand the area of that they can live and spread the disease. So the gains that we've made to improve health for people around the world are being threatened by climate change, but we can invest in climate action now to save lives and money in the future. So these are some of the things that guide the work of GCHA, particularly as it relates to COP. And I wanted to, before we get into the nitty gritty of, how a COP works, I wanted to ground ourselves in some of these actions that we're sort of thinking about as we go about this work. Oh, there we go. I was wrong. There are 7. Finally, there's a lot to learn from people who've been in the space for a long time. So we at GCHA have learned a lot from people who work in the Climate Action Network and who have been working in climate spaces for much longer than we have. And there's always, it's important that we in the health community not just talk to ourselves, but that we make time to listen to people who are being impacted by climate change and also have been working on this for a really long time, because we do have lots to learn from them. Okay, now for real, I'm moving on. Okay, so a little bit about the history of this thing called COP. The UN Framework Convention on Climate Change came into force in 1994 and has now been ratified by 198 countries. And the UN Framework Convention on Climate Change is frequently shortened to the UNFCCC. And that convention notes it was quite innovative for its time because it recognized that climate change was going to be a problem that affected the world, everybody, every country, and every person in the world, and that we needed to take collective action to address it. Right from the beginning, it put the onus on wealthy polluting nations to take the lead and to be responsible for supporting with money those countries that were going to be impacted by climate change. The framework suggested that we keep tabs on the problem and figure out a way to measure what's happening and what's being done about it. And also, even then, was saying we aren't going to be able to mitigate, we aren't going to be able to reduce emissions enough to stop climate change altogether. So we need a plan to adapt to make the world ready for a climate changed future. Within the UN Framework Convention on Climate Change, there are 2 meetings each year. One in June that is much more technical. There's the subsidiary body meetings for the scientific and technological advice and for implementation. And then there's this other meeting, the Conference of the Parties. So a meeting of all the people, all the countries who signed onto that framework convention that happens every year. And this year it's COP. That's the COP. This year we're at COP29. To give further context, we're going to talk about the Paris Agreement because that was really a formative moment in this COP process. So I'm going to share a video that articulates this better than I can. It's very clear, it's very short, and we'll share this link as well.
What is the Paris Agreement? The Paris Agreement is a legally binding international treaty on climate change to limit global warming to well below 2 preferably to 1.5 degrees Celsius compared to pre-industrial levels. This requires economic and social transformation to face the climate challenges now and moving into the future, based on the best available science. The Paris Agreement works on a 5-year cycle of increasingly ambitious climate action. By 2020, countries communicate their plans, known as nationally determined contributions. Countries communicate actions they will take to reduce their greenhouse gas emissions in order to reach the goals of the Paris Agreement. Countries also communicate actions they will take to build resilience to adapt to the impacts of rising temperatures. This may include information on adaptation and finance flows. The Paris Agreement also provides a framework for financial, technical, and capacity building support to those countries who need it. Starting in 2024, countries report transparently on actions taken. Collective progress under the Paris Agreement will be assessed through a global stocktake. This will lead to recommendations for countries to set more ambitious plans in the next round.
Sorry, a quick overview about what we heard. So after 21 COPs in Paris, we got a legally binding agreement that countries were going to take action on climate change. And it set the 1 point, as you heard, the 1.5 degree mitigation goal. So this goal that globally we would try to reduce our carbon emissions enough to keep global warming below 1.5 degrees. Since then, countries have been working to find a similar global goal on adaptation. We got to one finally. That has been harder because quite often adaptation needs to happen very locally. It's harder to get a global measure of what successful adaptation would look like. We finally got agreement around a global goal on adaptation at the last COP at COP28. And health is one measure in that. And now there is work to figure out the smaller, finer details of measuring that adaptation with indicators. So we know that countries are working on health indicators. So how would we measure succeeding on meeting this global goal on adaptation? I'm going to pause really briefly, Miliana. I don't want to put you on the spot, but I realize you also, do you want to add anything about the global goal on adaptation, given that you were at Bonn?
Yeah, thank you. Well, it's interesting that there is a specific health objective on the global goal on adaptation, and that also health will be measured throughout all the sectors. So adaptation it has a goal to reduce mortality and morbidity due to climate change. And through action in different sectors, adaptation action, we are going to be able to see it. And this is what we are going to be trying to measure with indicators that should be as easy to use by all of the governments around the world, but also sufficiently elaborate to show the progress. So that's not an easy task that countries are working since last year until the COP30 in Brazil. There we'll have the final selection of indicators that's going to be used to measure the progress.
Awesome. Thank you. So the Paris Agreement did another couple of things. It created the Green Climate Fund, which is this pot of money that is that wealthy countries are meant to put money into. The first goal for filling that pot was 100 billion. The countries that need support to mitigate their emissions or to adapt to climate change can apply with projects to the Green Climate Fund and get money out of it. And finally, as you heard in the video, the Paris Agreement initiated the first 5 years of nationally determined contributions, which is shortened to NDCs. I'll say a little bit more about that later, but very briefly, it's a series of plans every 5 years where countries are submitting what they're going to do to address the climate crisis. And then there's a process called the global stocktake. We just went through the first one where we measure globally, evaluate globally how we're doing on meeting those plans and those goals. So let's get into the COP. So the Conference of the Parties serves two main purposes: to review the implementation of the convention, the Kyoto Protocol and the Paris Agreement. So we're measuring or reviewing how things are going, and also to adopt decisions to further the development and implementation of these three instruments. And so it's when we say Conference of the parties in this instance are national governments. The way that I have thought about it, I'm just going to pause for a moment because I'm seeing a couple things. Okay, great. There, lots of them are links. Perfect. So I sort of think about it as there being four main things that happen at a COP: the government negotiations, program announcements, and other announcements like funding announcements, a lot of different types of events, and press and communications. And we're going to talk briefly about each one. Negotiations are really the main event. They are that process of figuring out between countries, making decisions about what we are internationally going to do together to address the climate crisis. Each country's negotiating team varies in size. So countries, unfortunately, often by resources. So wealthy nations are often able to send a big negotiating team who can have somebody in each discussion. Smaller nations often have, or sorry, not smaller physically, but nations who have fewer resources, often due to historical power differentials and colonial histories. Some of those countries with smaller budgets are able to send fewer people. And the way often when you have countries that have only been able to send one or two people, that's challenging because it means they can't have somebody in every negotiating meeting. And for that reason, and for other reasons, you get negotiating blocks. So a great example of this is the Alliance of Small Island States, AOSIS. And that means that those countries work together so that somebody from Tuvalu goes to one negotiating room on mitigation, for example, and someone from Vanuatu or Papua New Guinea can go to another meeting, and then at the end at opportune moments they come together and share what they're hearing and the various negotiating tables, because they don't have the resources to have a person in every negotiating room. There are many other negotiating blocks. Notable ones are on the screen: G77 plus China, the African group, the European group, and often you'll see the group taking a stance together. So at COP27, we saw the G77 plus China take a very strong stance around something called loss and damage that we'll talk about in a little bit. And they very strongly held this position that they weren't going to let COP end. Essentially, they weren't going to go ahead with agreements unless they got commitment to a loss and damage fund. And that's sort of the value of the negotiating blocks. Lots of work on the negotiations happens far in advance. So basically all through the year, and yet we do see big decisions still being made in those 2 weeks of COP. You've heard me mention a few of these themes and tracks previously, but a little bit of a plain language breakdown, because one of the things that's true about the UNFCCC is what the words mean in a COP or UNFCCC setting is sometimes very different than what they just mean in regular life. And in the UNFCCC, each of these words has a very specific meaning. So broadly, mitigation is how are we keeping warming to a minimum? Adaptation is how are we going to prepare societally for the warming that's already happening? Loss and damage, how are we going to pay for the impacts we haven't been able to mitigate or adapt to? Finance, who's going to pay for it? Agriculture and food security is, perhaps obvious. How are we going to manage food production in a climate change world? The Just Transition Work Program looks at how will we make sure the transition is fair for workers and for communities and for countries, between countries. And then another negotiation point to note is that sometimes there's what's called the cover text. So that's the Paris Agreement. It's like a big piece that summarizes everything that was negotiated in COP. There isn't a cover text every year. but it is often, when there is a cover text, it's often what you hear a lot about in the news. Because it summarizes all of the decisions. Ideally, it summarizes all the decisions that have been made in the other themes or tracks. Health is, as you will have noticed, not a specific negotiating track. We believe and have seen health be a tool for ambitious climate action. Stories about the health impacts of climate change can help to make abstract discussions personal. And health community plays a very important role, I think, in joining the rest of civil society to advocate for actions that protect health, whether or not the word health is in the text. And we'll have some examples of that in a little bit, but quite often you can have decisions that ostensibly might reduce global warming, but that might be bad for health. Or you can have people drag their heels because they don't see the benefit, the lives benefit that could be saved by making investments to address the climate crisis. And so health is a really important addition and argument in that case. And while there isn't a dedicated health agenda item, health is recognized in the Paris Agreement and in various outcome texts, those cover texts from COP. The right to health is in there quite often. Okay, so actually I'll go back a slide. So one of the ways that the health community has worked at COP for the last, I would say, I have to think about this. We've done it effectively for the last 2 COPs, and we did it sort of casually the COP before that. But what we have done is developed the health community meets daily, and people who have been following what's going on in the negotiations, people from the health community follow what's going on in the negotiations. We get together, usually at lunch. Everybody shares what they're hearing in the negotiations, and then people who are able to reach out to government folks take health positions that have been agreed on to different negotiators and say, you know, this is the health case for why we need why this should happen in mitigation, or this is a health case for what should happen on adaptation. And this year, our colleague Jess is working with whoever is interested to develop the health positions that we would take to negotiators. There's 9 kind of areas of health positions that we're developing. And I'm going to run through them. I'm not going to read them, but I'll read the titles. So the first 3 that we're working through are follow-up and accountability, health in the nationally determined contribution, and in all policies, mitigation, as we talked about. We're developing positions on adaptation, loss and damage, and finance. And finally, on food and agriculture, conflict of interest, and action with and for vulnerable groups. And the way to get looped into the development of those policy positions is that there is a policy Google group that you can apply to join. And once you join that, you should be linked into the opportunity to give input on the health policy positions going into COP. Another big focus, I'll pause here and then I'll go into that. Does anybody have questions about what I've gone through so far? Okay, I'm not seeing hands or questions in the chat. So I will continue. A big focus for this year is going to be what's called the New Collective Quantified Goal, or the acronym, because the UNFCCC loves acronyms, is the NCQG. I mentioned before about the Green Climate Fund and the $100 billion that was meant to be put into the fund following the Paris Agreement. The countries who owed the money didn't do that by 2020, but that money has now been raised. And because that first round of money has been raised, countries are now required to set a new number by 2025 and are trying to set and decide on and agree to a new number by 2025. And in order to agree by 2025, they are trying to figure out what the number should be by the end of this year. So the current negotiations are focused on how much money should it be, who's contributing. So the last time it was historically wealthy polluting countries, but there's some debate about whether current wealthy polluting countries should also be contributing to this fund. An example that comes to mind of a country that perhaps could be on the hook to put in money could be a country like Saudi Arabia, for example, that has been able to make a lot of money from oil, but isn't a previously historic polluter. That's something that's happened more recently. There's a question about, should this money only go to mitigation and adaptation, or should the money that's going to go for loss and damage also come from this fund? And how is it delivered? Again, Milena, I'm going to turn to you. I think we already started to see some stickiness about this at the meetings that happened in June. Did you want to add anything to that?
Yeah, basically, we saw in every negotiation room at different topics that negotiations were stalling because of the need to first agree on the new collective quantified goal, and many different issues around how the money would be collected, who would participate, is it going to be only government or private sector as well? Is it going to come in the form of loans or grants, which was the request of low and middle income countries? So there are still many questions to be clarified until the coming COP29, and hopefully this will resolve other issues in other negotiation tracks.
Yeah, thanks for that. I think a big point on the loans is we've seen in the past that when loans are given, countries sometimes get into vicious cycles where they are unable to pay back a loan, but are also unable to invest in what is needed to develop their health or education system. So I think there's been a real push not to have this money be in the form of loans. And I do think, as Milena said, there is like a risk that negotiations may stall out this year around, as everyone's debating the NCQG. So that will be interesting to see. A note about the UNFCCC and civil society. So much of what has happened that has been positive for people in relation to the negotiations has come with huge advocacy from civil society. So this idea that wealthy nations should be contributing money to support countries that have not been polluting but are going to be impacted by the climate crisis was really pushed for a long time. And then we got the polluter pays principle in the Paris Agreement. And so the first photo on the left, I believe that's the left of your screen, is an example of an action that happened at COP15 in Denmark, calling for wealthy countries to pitch in. There is, in my experience, often a huge Indigenous presence at COP, given that Indigenous people are often on the front lines of the climate crisis and are noticing the ways that their lands have changed rapidly. The lands and their homelands, territory that they know well, has changed in the last 20 years in the face of the climate crisis, and have had their livelihoods deeply impacted by that change. And so advocacy by Indigenous people over years at COP eventually led to the creation of the Local Communities and Indigenous Peoples Platform, which is a process that runs concurrently to COP, where, as I have witnessed it, I'm not deeply involved, but I have tried to go in past years, and Indigenous people from around the world make statements about the ways they are seeing climate change impact their communities. And then they, after a few days of sharing by elders and young people and community members, they present those findings directly to COP negotiators. So COP negotiators are going into their negotiations having heard directly from Indigenous people. And it's not a perfect process, but the process, such as it is, only exists thanks to activism from Indigenous people themselves. And then finally on the right is a vigil at COP27 for loss and damage, where you had this huge push from civil society, including health folks among civil society, to create a fund so that when a disaster happens, like flooding in Pakistan, countries have a fund they can directly go to if they can say this wouldn't have happened without the climate crisis, and they're not needing to fundraise through or rely on fundraising from the charity of other countries or through groups like the Red Cross. There's a fund that exists because we know these damages will happen. And after a lot of advocacy, both by negotiators and by civil society, we got the loss and damage fund. So a note that civil society action is extremely important. And health has very much been bringing its voice to the conversation in recent years. This is a group of young health professionals and young at heart health professionals doing an action at COP last year. And I think, again, health actors are trusted. We bring a strong argument to the case for climate action. And so it has been heartening and I think impactful to have health actors showing up. The reason lots of civil society advocacy isn't demonstrations, it's just that the demonstrations make good photos. Civil society activism is all of that outreach to negotiators. It's outreach in people's home countries. It's connecting with the negotiator you happen to meet on the bus. And I think all of that activism really does make a difference, particularly because negotiators also know that people are watching. And we know that there are also frequently were certainly more, I believe there were quite a few more fossil fuel lobbyists at COP than there were health professionals at COP. And so we are also counteracting a powerful force by industries who are invested in business as usual and continuing our use of fossil fuels the way that we do, because their bottom line depends on it. And so civil society broadly and health civil society among that have a really important role to play in counterbalancing lobby efforts by industries who stand to benefit from continuing to exploit fossil fuels and contribute to the climate crisis as they do. Okay, so 3 other things that happen at COP. One of them is program announcements. So at COP26 in Glasgow, we had the launch of ATTACH, the Alliance for Transformative Action on Climate Change and Health. It's hosted by WHO, and it brings together member states who are working to transform their health systems. And I think it from what I understand, provides really important opportunities for countries to work together and solve these problems together. You also sometimes get funding announcements at COP or other sort of agreements between a small group of countries who are going to work together on something. COP is also a time with a lot of events and meetings. So there's high-level side events that are within the official COP programming. There's pavilion events. The WHO for the last 4 years, I believe, has had a pavilion. There are also, ideally, there will be health events at pavilions other than the WHO pavilion, because COP is and can be a good time to get outside of our silo to meet other people in the climate space. And then it's also a time where people take a lot of advantage of many people who are working on this being in the same place to have a lot of meetings. And it is while it is a really unique opportunity to meet people in the space, I don't want to make it sound like you have to be at COP to work in this space. And the reason I say that is because, again, it's really expensive to get accommodation in a city where COP is happening. It's really hard to find accommodation in a city where a COP is happening. And if you can't get inside the main venue, which I'll talk about in a moment, you're not going to get that much out of it. So I don't want to make it sound like COP is like, you have to go to it. It's not. It is a lot of people who are working on this, but much of it is frustrating and expensive. And yeah, only go if you have to, I guess, is what I'm saying. This slide has the note that applications for the WHO Pavilion were due on the 15th So my apologies if you didn't see this before that. But there may still be, if you're going to COP and you want to host an event, there may still be other pavilions that have space. The pavilions are hosted, they're like small rooms. Usually they're small rooms within a conference venue. And many countries have pavilions, and then many sort of UN organizations, and then some non-UN organizations have pavilions, and then there are themed pavilions. So the last couple of years there's been a youth, children and youth pavilion. There's often a resilience pavilion. So I think there's I actually am not going to guess a number. I was going to there's probably over 200 pavilions from countries and organizations where there is a lot of programming happening throughout the 2 weeks of COP in addition to the negotiations. And then finally, a big thing that happens around COP, both from the venue but also around the world, is it's a time when the international press and national press are paying extra attention to the climate crisis. So if you are in the venue, it is often much easier to find a journalist who might want to interview you. But it also, even from home, is a time where you might be able to get a climate story across a little bit more easily in your home country because the press is paying attention to climate change in a way that they don't usually. This is a note from last year. So last year was the first year that generally COP will have several thematic days. So each day will have some kind of focus. And last year was the first year that there was a health day. And on this health day, there was an interministerial meeting on climate and health. 143 countries signed on to the COP28 UAE Declaration on Climate and Health, and $1 billion of finance were announced for climate and health, as well as principles to guide that finance. I think it was exciting and impactful to have we had more health ministers there than had ever been before. And I think that we saw, I think that this is the next slide. Yeah. A really interesting and important gain from so many health ministers being at COP was that then at the World Health Assembly in May, a resolution on climate change and health was passed. And many ministers were able to draw health ministers. I had not previously heard health ministers talk about the health impacts of climate change the way they did at the World Health Assembly. They talked about it like they understood that this was something they should be looking at in order to protect the lives and health of their populations. They talked about it like they were engaged and they cared and like it mattered. And I do think that is part of the legacy of this interministerial that happened at COP, and also the legacy of a lot of advocacy of folks, some of whom are on this call. As I said, we also got this establishment of guiding principles on financing for climate and health. And the Green Climate Fund has recently added a senior specialist on climate and health, which is interesting to me because as far as I understand, until last year, only 2 health projects had been funded by the Green Climate Fund until that moment. So I think having the fund pay a little bit more attention to health will be helpful. I think there is some work that I am not super clear on between the various COP presidencies. So each year a different country hosts COP, and they are, the COP president for that year. And there is an effort to have a continuity coalition between the hosting presidencies around health and climate change, but that announcement is new. And I don't feel very confident about the details about it. So I can't answer questions on it now, but hopefully as we get sooner to closer to COP, we'll have more information about that. I don't know, Milena, if you want to say anything else about that, having heard WHO talk about it. I'm not sure that we got further details, but definitely jump in if you have anything to add.
Nothing to add, but the webinar was recorded where the COP29 presidency announced the several initiatives they have on health. As far as I remember, one was focused on cities and the other on resilience. Together with this continuity effort from the presidency of the UK to the presidency of Brazil next year. So I'll post the link to the webinar so everyone can see it.
Awesome. Thank you very much. Okay, so a couple of logistics. So I mentioned this briefly that it rotates each year. The various regions of the world, there's the 6 regions of the world, are not the most intuitive regions of the world, but here they are. So Western Europe and other states, which includes the US and Canada, African states, Asia Pacific, Eastern European, and then Latin America, and the Caribbean. And then after that is, I believe, like not Asia Pacific, like it's like the Pacific or Oceania. I don't remember what the 6th one is called. So each group of countries gets to choose which country will host. We were at the Space of the European States hosting. Russia is one of the Eastern European states, and Russia did not want, as we understand it, did not want any country that is part of the EU or has made a bid to be part of the EU to host. And that led this decision to have the COP be in Baku in Azerbaijan. That decision was made somewhat late. For example, we already know that next year's COP will be in Brazil, and we've known that for, I believe, at least 6 months already. So Brazil has had, at least 18 and in some ways 24 months to prepare for the COP that will happen in 2030. Baku has had less time than that, and I share that only because I think we can offer grace in some ways to that team for some of the logistics challenges that may be happening. It seems like logistics are slightly more challenging given that they had a shorter time to prepare. Okay, so you've heard me mention accreditation and badges. There's 2 zones at COP. There's a blue zone where the negotiations happen and you need a badge to enter that. And then there's the green zone that is open to the public. It's meant to sort of be a service to whomever, the city where COP is happening. And passes to the green zone are usually much more accessible, and families can go and school groups can go. This is a picture from COP last year. My understanding is that this year, once again, the blue zone and the green zone will be in the same building. Again, at the beginning of the conversation, Milena posted a link to the webinar we ran on how organizations can get accreditation. That is a process that you need to start probably more than a year in advance to get into the blue zone. But if you there are things to do in the green zone. Again, I would maybe caution against traveling to Azerbaijan only to access the green zone. But good to have a sense that there are things happening that you don't need a blue zone badge for. This is the center. It's a stadium. It's an Olympic stadium in Baku where the conference is happening. And again, all under one roof is the sort of idea whereby the blue and green zone will be in the same place. Milena mentioned a couple of these, but just to put on your radar, notable dates for this COP are the 18th, 19th, and 20th of November. So health has been grouped in with Human Development Day on November 18th. The focus is going to be health, education, jobs, green skills, and we believe that there is going to be a high-level event with this group of ministers, which could be valuable. Obviously, food and water and agriculture have important intersections with health. And I think urbanization is going to also have a health element as well. So there's 3 days in the second week of COP that will have some level of health focus. Okay, I'm going to, again, pause briefly. Oh, thanks, Christina, so much for posting those. Okay, we've got, I believe, one more section, which is this short focus on national plans. So you've heard me mention nationally determined contributions. Again, they're often made an acronym, NDCs, not to be confused with NCDs if you are working in non-communicable diseases. But yeah, NDCs, nationally determined contributions, are the plan that each country has to develop every 5 years of what they are going to do to reduce their emissions and contribute to the Paris Agreement. So we've had a first round of NDCs that were submitted. They were due in 2020. I think many of them were late because of the pandemic. But the commitments we got from the 2020 contributions were insufficient to keep us below that warming number of 1.5 degrees. Some NDCs do include health, but a thing we've learned is that the inclusion of talking about health doesn't mean the plan is ambitious enough to protect health. So several years ago, GCHA did an evaluation of NDCs from a health perspective, and then last year we did an evaluation of NDCs from an air pollution perspective, where we looked at the country's NDC as it was submitted in 2020 and asked, what does this say about health? How does it include health? And is it ambitious enough to protect health? And similarly, we scored, in the later edition, we scored the countries on air pollution. How were they responding to air pollution? And as an example, not picking on Argentina partially because it comes early in the alphabet, but also because it's a good example of this tension that we saw in many other countries' plans. We saw Argentina's NDC actually did talk about taking action in the health sector, and it talked about the health co-benefits of mitigation and adaptation, and so was doing quite well in some ways, getting 9 out of 18 on having health incorporated meaningfully in their NDC. There were many, many countries that got 0. They didn't mention health at all. But when we look at Climate Tracker, which is another organization who did the calculation on how ambitious was a country's NDC, what were they going to do on mitigation, Argentina's actions had us on track for 4 degrees of warming. And we know there will be massive health consequences if globally we warm to 4 degrees. And so here we have an NDC where health is mentioned, but the country is not ambitious enough to the plan is not ambitious enough to keep warming below 4 degrees or below 1.5. And also we know that some countries, the reason they're finding that challenging to be ambitious is lack of resources. So again, I think it is going to come back, even this conversation about the NDCs is going to come back to the new collective quantified goal. We're in a year where the next NDCs are due in 2025, early in 2025. They're due in February. We expect many will be late, which is fine. But this is a really unique time for health actors to get, if we can, to encourage health ministries to be involved in the development of their national plans to address climate change in the NDCs. Part of my reason for pushing this comes from something that Hendricks from Malawi said at a session a couple of years ago, which is he works for the Ministry of Health in Malawi. He was able to get involved in the drafting of their last NDC. And as you can see, I know it's a bit small, but Malawi's NDC was actually quite strong on talking about health impacts, putting health and adaptation, talking about health adaptation in their NDC. And they got bonus points that I don't remember what the bonus points are for, but they also talked about health co-benefits. So you can see that having health, he advocates that getting in the door when the NDC is being drafted is a really important way to bring health ministries into conversation with other sectors that are working on climate change, with energy, transportation, the environment, and finance, so that the action that is being planned around climate is also health protective. It's different in every country, the way that the NDC is being drafted. So we don't have a blanket suggestion for how to get involved with a country's NDC. But I do think it's important to note that this is a moment. Some countries, in addition to NDCs, also submit national adaptation plans that lay out what their medium and long-term adaptation needs are. Some of them include health in their main plan, and some of them develop a separate health plan. So it's also worth looking into whether your country has a health national adaptation plan or just a national adaptation plan that includes health in some way, to get a sense of what your country might be planning to do related to preparing for adaptation. Okay, I realize that's a lot of content. So closing up, upcoming programming is that sometime in mid-October, the policy positions that we mentioned that Jess is working on will launch, and they'll be available for countries to sign on, or not countries, sorry, organizations to sign on to. On the 6th of November, for those people who are traveling to COP, we're going to host a call that goes over final logistics. So like anything we know about transportation in the city and where to pick up a badge, and any final tips, as well as a policy overview. And then during COP, we will have daily policy meetings. And again, if you are going to COP, we will again be running a Signal chat, Signals like WhatsApp, for everybody who's at COP, as well as a policy group. And we usually try to put together a useful links document so that all of the links you might need to kind of navigate COP are all in one place. So having come to this session, we will do our best to send those to you because you've signaled that you're interested in COP. So be on the lookout for emails from us with those updates. That is all for me. Very happy. Oh, and Milena, thanks so much for sharing the Clean Air Scorecard. Yeah, I'm happy to take any questions. Again, because I know we covered a lot, and yeah. And you can raise a hand or put your question in the chat. Yeah, Christina.
Hi, thanks for the great presentation. It was very, very informative. I'm just curious. So there are a lot of negotiations going on at COP, but what are the levers, or how are countries being held accountable to their claims or what they have promised? Yeah.
That is a great question that I don't have a super solid answer to. I think that a lot of that accountability happens by civil society nationally. So you have something like the Climate Action Network, for example, both tracks very closely what countries are negotiating at COP, but then I can speak from my own context. I know that the Climate Action Network is in Canada, reaching out to parliamentarians and government folks through the year to say, hey, you committed to this, are you doing this, and how are you doing this? So, pardon me. So I think it varies from country to country, but I definitely agree. And I think that there is some, ostensibly, because the Paris Agreement is legally binding, that's an agreement that is meant to hold people accountable legally to each other. But it is certainly tenuous. And I think more of the accountability comes from organizing nationally. But it's a great question, and I wish I had a better answer. I think it's something we're still trying to figure out, actually. We're trying to figure out, okay, like we can push them at COP, but how do we support people from the health community to be involved in that accountability throughout the year? And something we're working on.
Thank you. Actually, that leads on to my next question. I'm also just curious to know, why was Health Day announced last year? Like, why was there this new interest in health and climate? Why not earlier? Why not later? And why last year? Yeah.
Another great question. I think a non-cynical answer is that the awareness of the intersection between health and climate, I think, has really grown in the last even 5 years. I think that the pandemic meant that countries realized that a health crisis could bring them to their knees in a way that we maybe hadn't collectively realized before. And so there was more sort of awareness of that intersection between health and climate change. And historically, from what I understand, the the government of the UAE has been interested in funding health initiatives. They run, I believe that they fund the acronym is GLIDE, but the focus is like neglected tropical diseases. So it was hosted in a country with an interest in health in some way. And I think a country that felt like, again, from what I've heard, that the UAE felt like hosting this meeting was their entry as a global player on the scene. And they did do a lot of outreach to a lot of communities, not just the health community, but the health community in a major way to try to, I think they wanted the COP in the UAE to be memorable by introducing sort of new initiatives and bringing new voices to the table. Because they were seeing this as a really big moment for them on the global stage. I think the health community broadly was concerned when they announced their interest in health that given that the UAE is also a state with a lot of interest in the oil industry, that they might be using health to kind of health wash the COP, so that they might have been hoping that they could talk a lot about the first health day and protecting health from climate change and funding for health, and that those big announcements might mean that they could talk a lot about health and be celebrated for that and not be pushed on their own fossil fuel expansion or the ways that they are that they would not be pushed on fossil fuels essentially. I don't think that was the case. I think they were pushed on fossil fuels by the health community. Even we had a letter from 8 fairly influential health organizations noting the need to phase out fossil fuels, but I think that there was certainly concern that the health focus might have been, the more cynical take was concern that the health focus was to take attention away from fossil fuels. But I think all of the things can be true. And I do think some of it is the more impacts of climate change we see, like the more floods we see, the more displacement of people, the more malaria spreads, the more health comes into focus and is seen as something that needs to get attention, because we're also seeing in a totally different context for the first time ever. Next week is New York Climate Week. And there's 10 themes at New York Climate Week. And this year, for the first time, health and climate is one of those themes. And I did not expect that to happen ever. So I think something has shifted in the global consciousness around this intersection.
Thank you very much. That was great. Thank you.
Yeah, thank you. Oh, someone going into the blue zone as an observer. I mean, I think like definitely stay connected to us. That chat that I mentioned, the Signal group, will be all the people from the health community who are at COP. And it's definitely, I think, really valuable if you're in the blue zone to go to listen in on a negotiation. Sometimes the negotiations are quite dry. It's people like debating very specific language that seems like it is nitpicky, but actually has great meaning. Like often it can seem like somebody's just arguing about words, but that there's like a whole history of politics behind that negotiation. So yeah, I think you pick something you're interested in and have a listen enough so that you kind of get a sense of what's going on in there. But it definitely do that based on what you're most interested in. Like I think some people really like mitigation and some people really like food and agriculture. So yeah, happy to connect with you and support you in finding a negotiation you're interested in. I think it would just be, maybe this is a really nerdy thing to say, but I think I would just mostly encourage people to make sure they don't only go to events at pavilions. Like if you've got a blue badge, try to sit in on at least one negotiation because you're there. So if you can get in there and see how it all works, then take the opportunity, because it is possible to go to COP and just only be going to events because there are a ton of events. But I think yeah, I'd encourage people to sit in on negotiations if you can. Sorry, that's kind of a long answer.